Good morning, everybody. My name is Zara Rothenberg. I am an independent contractor. I'm licensed by the state of California, and I'm certified by multiple insurance company to provide this information to you. So before we start this session, starting October of 2023, Medicare requires that I read the statement to you. Even though we're not going to cover any specific product during this session, I still am required to indicate that I do not offer every plan in your area. Currently, I represent 11 organizations which provide Advantage and prescription drug plans. If you want to know how many organizations and how many plans are available in your area, please contact Medicare.gov or 1-800-Medicare or your local state health insurance program to get information on all of your options. Okay, so the topics we are going to cover today is we talk about Medicare eligibility, when you become eligible for Medicare and what time period. The next one would be Medicare choices, what choices you have when you join Medicare. Then we cover different Part A, Part B, Part C of Medicare. Briefly, we talk about Medigap, which is also known as the supplement plan. Then we go into prescription drug. We talk about the drug tiers and drug stages. And finally, at the end, we briefly talk about extra help with prescription drug, if you qualify to get extra help with your drugs. As Nevin mentioned, we're going to stop a couple times to answer your question throughout the presentation. Please enter all your questions in Q&A. And Nevin is nice enough to read them to me, and I would answer them. And at the end, we also have allocated some time for your Q&A. If your questions are specific to you, please wait until the end to ask me the question. But if the question is general and everybody can benefit from the answer, please go ahead and ask the question when it's time to ask question throughout the presentation. Okay, next, we go to Medicare eligibility. When you turn 65, you are eligible, you are entitled to your Medicare Part A, and you're eligible for Medicare Part B. And sometimes, if you've been disabled, you're also eligible, even if you are younger than 65, you are eligible to join Medicare. You have to be a U.S. citizen or a permanent residence, legal permanent residence for at least 5 consecutive years in order to qualify for Medicare. So once you qualify for Medicare, there are certain time period that you can join Medicare. The very first one is called initial enrollment period. Initial enrollment period is when you're just turning 65. Is also referred to as IEP. For IEP, you basically have 7 months. You have 3 months before the month of your birthday, you have the month of your birthday, and you have 3 months after the month of your birthday. Total of 7 months that you can join Medicare. Now, all this eligibility period refers to if you want to sign up for Medicare Part A and B, and also Advantage and prescription drug plan. It does not apply to the supplement plan. So for initial enrollment, you have 7 months. As I mentioned, 3 months before, the month of your birthday, and 3 months after. So for example, if your birthday, let's say, is July 15, you basically have from April 1st through October 31st to sign up for Medicare or Advantage or prescription drug. Now, if you sign up in April or May or June, the effective date for your Medicare would be July 1st. If you apply in July, August, September, or October, then the effective date would be the first of the month following the time you signed up. So this would be your initial enrollment period. The next one we're going to talk about is annual enrollment period. Annual enrollment is the green bar, is from October 15 through December 7th. Basically, annual enrollment is for those who are already part of Medicare. And at this window, it gives you the opportunity to sign up for a different Advantage plan or go to a different company, So basically, you have this opportunity once a year to change your plan, because plans, premiums, and benefits change throughout the year. It's always good to check and make sure the plan you have is the best plan for you. The next one would be the light blue area, which is called open enrollment period. It's from January 1st through March 31st. In this 3-month window, if you have an Advantage plan and you want to switch to another Advantage plan, this gives you an opportunity once a year to do that, but it only applies to the Advantage plan. The last one would be a special enrollment period. A special enrollment period doesn't have any specific time. It could be any time of the year, but you need to qualify for the special enrollment criteria. You have to have a qualifying event. The events could be either you retire, let's say you're 65 and you're still working, so you don't apply for your Medicare until you turn 70. Then you decide you're going to retire at the age 70. At that point, you go get your Medicare card, and then you're going to apply for an Advantage plan. So in that case, regardless of what month of the year is, you are under a special enrollment, you can sign up. If you move out of your service area, because all Advantage plans are for the county where you reside. So if you move out of the county and go to another county, then you fall under special enrollment. You can look and see what other plans are available in the new county, and any time of the year, you can change. If you receive assistance from state, like Medi-Cal or any assistance you get from a state, you qualify for a special enrollment. If you have some chronic illnesses or any disability or chronic illnesses, you qualify for special enrollment. If you get extra help from state for your prescription drug, you qualify for a special enrollment. So a special enrollment could be any time of the year, but you have to have a qualifying event in order to change that. So next, we're going to talk about, well, what is Medicare? Medicare consists of Part A and Part B. Part A is for inpatient hospital. You have to get admitted to the hospital at least for one night. And Part A covers 100% of the cost, and it has 0 premium. And but it has a large deductible. So Part A, even though you don't pay any premium, it has a deductible. Part B, on the other hand, is for outpatient hospitals. Like if you have a surgery in the hospital in the morning and they send you home, that would be outpatient. It's for all your doctor visits. Any lab work you have falls under Part B. Part B only covers 80%, unlike Part A that covered 100%. Part B only covers 80%. The other 20% is up to you. It does have a premium, and it has a small deductible. And combined, they refer to it as original Medicare. So if somebody says, I have original Medicare, they're only referring to Part A and B. Once you apply for your original Medicare card, you receive a Medicare card. Some refer to it as red, white, and blue card. it would indicate your name, your Medicare number, and the effective date for your Part A and Part B. If you apply for Part A and B at the same time, obviously this effective date would be the same date. If you apply for it at different time, then it would be a different effective date. Okay, so when you get Medicare, because Part A has a large deductible and Part B only covers 80%, and combined, it does not cover prescription drug. Most people, after they get their original Medicare card, they go to private insurance company to get additional insurance to complete their coverage. So once you go to private insurance company, you basically have two options. Option one, in addition to your Part A and B, you go and apply for a supplement insurance, also referred to as Medigap. Is a MedSup or Medigap. So basically, this MedSup fills in the gap that A and B does not cover. It covers your deductible for Part A, it covers your 20% for Part B, but it does not give you prescription drug. So if you choose option one, after you get your supplement plan, you have to go and choose a standalone prescription drug plan to have a drug coverage. And in this case, you would carry 3 cards with you at all times. You would have your Medicare card, you would have your supplement card, and your drug card to have a complete coverage as far as your health goes. So this was option one. Option two, in 1990s, Medicare realized that they spend a lot of time on administrative and the processing the claims for each individual. They made contracts with private insurance companies such that Medicare pays the insurance company a certain amount of money for every member, and then the private insurance company would take care of the processing and administrative work of your plan. In this case, you still have all the benefits you had under A and B, but those benefits are embedded into this option two, which is referred to Advantage or Part C. So with the Part C, it covers the gap that Part A and B doesn't pay. In addition to that, it provides you with prescription drug. When I say it provides you with prescription drug, it's only the premium for the drug is covered. You still have to pay your copay to buy your drugs. The same here. You pay a premium and you have to pay a copay to buy your drugs. So it gives you that, it saves you the premium on the drugs. And in a lot of cases, it gives you additional benefits. For example, it could give you a certain allowance for over-the-counter drugs. It may give you some transportation to take you to your doctors, depending on which plan you choose. So there are advantages and disadvantages on each of these options. The benefit of the supplement plan is flexibility. It allows you to go to any doctors, any hospitals, anywhere in the whole US, as long as they accept Medicare. Let me repeat that, as long as they accept Medicare, because not every doctor or hospital accepts Medicare. So if you go to a new doctor, new hospital, ask them if they accept Medicare. Otherwise, you have to pay out of pocket. So this is really a good flexibility, because let's say if your ophthalmologist is in Alameda County, your primary is in Santa Clara County, and your dermatologist is in San Mateo County, as long as they all accept Medicare, you can keep all of them. And once you go to the Medicare and supplement, you don't have to change anything because you're allowed to go to any doctor, any hospital, anywhere in the whole US. So that's really a good thing. But the disadvantage of that is the premium for this plan goes up by your age. So it starts at the age 65, and when you take 66, 67, it keeps on going up. And not only that, sometimes the rates get adjusted because of cost of living. So once you get to your 70s, you could be paying a chunk of money for premium for this plan. Plus, since it doesn't cover prescription drug, you have to pay a premium for the drug. So this is, basically the facts about option one. Option two, the disadvantage of this plan is you belong to a network. If it is an HMO plan, you belong to a network, you have to have a primary doctor. Your primary doctor has to refer you to your specialist, and you are not allowed to go out of the network. If it's a PPO plan, you still belong to a network. However, the PPO allows you to go out of network, but you may be subject to additional costs because the plan only pays for the doctors that are in the PPO network. So it allows you to go out, but you pay more if you go out. And then it gives you the prescription drug. So that was the disadvantage. The advantage of this plan is the premium. There are some plans that have zero premium, that you don't even have to pay a premium and get all these benefits. And then some have, various like $49 or $100. It depends which company you go to and what you get for the premium you pay. So the premium would be the same whether you're 65 or 95 for the same plan. It's not like the supplement that every year it goes up. It's the same premium regardless of your age. And then the other advantage was it gives you the prescription drug and other benefits. Now, a lot of people at this point, they ask me, well, Zara, which one is better? And my answer always is, it depends. It really depends on the individuals. If you have several doctors all scattered all over the Bay Area, and it's important to you to keep those doctors, then you may want to consider a supplement. On the other hand, if you go to the same medical center, say if you go to Palo Alto Medical Foundation for your primary, for your specialist, for everything, you may want to think to yourself, well, what am I paying so much more? Why don't I go to an Advantage plan and pay less and still continue going to my doctors? So it really depends on what's important to you and on the individual needs. Okay, yeah, Nevin, I'm going to stop at this point. I gave a lot of information. Let's see if there's any questions, please.
Yes, sure. I'm checking the Q&A box. There is no question in there.
Okay, so we move on. If you think of question, you can always ask at the next time we stop.
Okay, thank you.
Okay, so now I'm gonna give you some amount. Oops. Wait a minute. Okay, so
Sarah,
yes.
Sorry for interrupting. There is just one question in chat, it just appeared.
Okay.
Can you give an example of an Advantage program?
Example of an Advantage program is if you sign up for a HMO plan. The HMO could be with any company. It could be, with Anthem, Blue Cross, Blue Shield, United Healthcare, any company. When you sign up for their Advantage plan, depending on the company, you pay a premium, and then once you get into the Advantage plan, you would have a copay. For example, if you go to the hospital, there is a copay for how many nights you can stay and what you pay. If you go and see primary, some plan says you pay zero copay. If you go and see your specialist, they may say you pay $5 or $10 copay. So there are copays, even though the Advantage covers what A and B does not cover. within the Advantage, you have copays that you have to pay. And if you decide to look at the Advantage, you really don't just look at the premium. Look at the whole package of what the benefits are and they're your advantage, because sometimes you pay a little bit more in premium, but you get a whole lot more in benefits. So you have to look at all the details about the plan.
Thank you. Can we get one more question?
Sure.
How does Medicare work if you travel internationally?
Both of these options, they cover you for emergency, whether it's supplement or Advantage. If it's an emergency, they cover you. If it is a supplement plan, they cover you up to $50,000, but you have to pay 20% and the plan pays 80%, and you have a $250 deductible. But maximum they cover is 50,000, not 50%. Maximum they cover is 50,000, but you have to pay 20% of the cost. If it is Advantage and in an emergency, they cover you, but the coverage is subject to what the plan covers. For example, if the plan says you have to pay $250 per night for the first 5 nights, the same requirement applies to if you stayed in a hospital abroad. So it covers you. But whichever one you choose, you have to bring some proof that it was an emergency. Because some people, may get a cold or something and they go and see a doctor and they come back and said, well, I was in Europe and I got sick and I went to a doctor. Well, getting a cold or something doesn't qualify as emergency. Emergency is if life-threatening or if it's something that needs immediate attention. For example, if you get into a car accident, you need to be taken to the hospital, and so that would be an emergency. Okay?
Thank you. And one follow-up question. In that case, if it's emergency and then they visited the hospital in abroad, would you pay it and get reimbursed?
Yes, you pay for your bill because the insurance, let's say Germany doesn't deal with your health insurance. So you pay your bill, you come back and make sure you have a statement that it was an emergency. Then you submit the bill to the insurance company and they would reimburse you.
Thank you.
If they review it and make sure that it was an emergency.
There is no more question. We can continue, I guess.
Okay, thank you. Okay, so I'm going to give you some amounts because I told you has a deductible, or now I'm going to give you some amounts that you can understand, what the cost is. So again, when you are 65 years old, or in some cases, if you're under 65 and you've been disabled for at least 24 months, you qualify for Medicare Part A and B. Or if you have some illnesses like end-stage renal disease. End-stage renal disease is like kidney dialysis or ALS. Even if you're younger than 65, you qualify for Medicare. You have to be a U.S. citizen or a legal resident who has lived in U.S. for at least 5 consecutive years. Now, Medicare Part A is for inpatient hospital care. It has a 0 premium, but the deductible for the first 60 days, you pay $1,600. So whether you stay 1 day or whether you stay 60 days, you pay $1,600. Now, this amount changes every year. So this is for 2024. So you pay $1,600. If you stay more than 60 days, for the next 30 days, days 61 to 90, you pay another $400 per day. And then in addition to the 90 days, you have a 60-day lifetime coverage at $800 per day. So when it's a lifetime, like 1 year, you may use 5 days out of the 60. And 3 years later, you may use another 10 days out of 60. So you have 60 days lifetime. So this is a chunk of money. And then Part A also covered skilled nursing. You pay 0 premium for the first 20 days. After that, you pay $200 per day for day 21 to 100. Then rehabilitation facility is covered. Home health care is covered. Home health care is not long-term care. Home health care is after skilled nursing. If you go home and a nurse could come and visit you, you stay in your own house, then there is a 0 copay. And then it also covers hospice. So this is Part A. Now, this is what it would cost you if you do not have option 1 or option 2. Once you get one of the options, they pretty much cover all or most of this, okay? So don't panic. This is only if you don't have any additional insurance. So we move on to Part B. Part B is for services of the doctors or lab work. It also covers outpatient care. Outpatient care is even if you go to a hospital and have a, let's say, cataract surgery, they send you home at night, that falls under Part B because you didn't spend the night at the hospital. It covers home health care. It covers some of the durable medical equipment. Durable medical equipments are like a special bed, wheelchair, even a CPAP machine falls under durable medical equipment. And then it covers some of the preventative services. Again, with preventative services, once you sign up to Advantage plan or supplement plan, they cover more preventative. So then we go to Part B. Part B, as I mentioned, only covers 80%. The other 20% is up to you. That's why you get option 1 or option 2. The minimum premium for Part B in 2024 is $174.70. So that is the base. And it is based on, if you collect Social Security, they automatically take this out of your Social Security, that the check they send you. If you do not collect Social Security, they would bill you and you have to write a check and send it to Medicare. Now, the base pay is $174.70. And that is based on your modified adjusted gross income. If you file your taxes as a single person and you make up to $97,000 a year, or if you file taxes as joint and you make up to $194,000 a year, then you only pay the base of $174.70. If your modified adjusted gross income is higher than these two, then based on how much higher, there is a scale that Medicare would send you a letter and say, because you made more, then you have to pay more. And basically, they base it on your taxes. For example, now we are in 2023, they look at your taxes in 2021, because not everybody has filed their taxes for 2022. So they go back 2 years to make sure everybody has filed their taxes. The Part B does have a deductible of $240 in 2024. And this is very important. If you are 65 and you do not have any other, what they call it, creditable insurance. Creditable insurance is an insurance that is at least as good as what Medicare offers. If you do not have any creditable insurance and you do not apply for Part B, you may say, well, I'm really healthy. I don't even go and see a doctor. Why do I want to pay $174.70? When I get sick, then I join Part B. Well, it doesn't work that way. Once you turn 65, you either have to have creditable insurance either through yourself if you're working or through your spouse, or you would be subject to a penalty. And the penalty is 10% for every 12 months that you were eligible to have insurance and you didn't get it. And the penalty is lifetime penalty. It's not just for the duration that you didn't pay for the insurance or 1 year or something. It's for lifetime. So this could be a significant amount. So it's very, very important that if you turn 65 and you do not have a creditable insurance, sign up for your Part B. Okay, so we move on. Now we're going to go to Part C, which was the Advantage. With the Advantage, as I mentioned, it's run by private insurance company that have been approved and contracted with Medicare, include all the services that Part A and B covers, but it gives you additional insurance. It includes, you know, like prescription drug or other benefits. And then the premium and deductible could vary based on the insurance company and based on the county where you reside. So one company may ask you to pay a premium if you're in Santa Clara, different from the premium if you are in San Mateo County. So it depends on which county you are and which company. So it varies. And next. Okay, the only thing that with the Advantage Plan Part C, they don't ask any medical questions. The only two requirement is, first you have to be enrolled in Medicare Part A and B. What A and B has to be active. And you have to live in the service area. Service area is the county where you reside. So you can only apply for a plan that is for your county. Next, we briefly talk about supplement. You see, supplement is not overlooked by Medicare. So a lot of requirements that I talk about as far as eligibility to enroll or the statement I read to you at the beginning, they all apply to the Advantage or prescription drug, but they do not apply to supplement. Supplement is overlooked by the Department of Insurance. But I put a slide in here because a lot of people ask me, well, what is the supplement? You mentioned it at the beginning. What happens? So with the supplement, it kind of fills the gap that original Medicare does not cover. And you have 6 months enrollment period to sign up for your Part B. For example, if you're working and all of a sudden you retired, you basically have 6 months or when you're turning 65, you have 6 months to sign up for a supplement plan, and they do not look at any pre-existing condition, because in that case, they call it guarantee issue. You guarantee you're going to get in if you are just becoming eligible and you get in. But later on, if you want to change your plan to go to a different company, then you may be subject to health questions. And if you answer yes, they may not accept you. Whereas the Advantage had no health questions. You're guaranteed you get into the plan regardless of pre-existing condition. It allows you to go to any doctor, any hospital, anywhere in the whole US, as long as they accept Medicare. And the premium increases by your age, and it does not cover prescription drugs. So basically, in a nutshell, this is what your supplement is. Okay, now before we go to prescription drug, Nevin, is there any questions?
Yes, there are. Let me see. Are the premium and deductible monthly or annual?
Okay, the deductible is annual. When I say deductible, is once a year. So once a year, you pay your deductible. Then after that, you paid for the rest of the month. The premium is monthly. The premium is what you pay to get your insurance. Like for the premium, you pay $174 for your Part B. Every month you pay $174. They deduct it from your Social Security benefits. And then when I say copay, which later on I'm going to introduce copay to you with the prescription drug or even with the Advantage plan, copay is per usage. For example, if they say if you go and see your primary doctor, you have to pay $5. Well, if you don't go and see any doctors, you don't pay the $5. But if you go and see 10 doctors, then you have to pay $50, $5 per visit. Or if you stay in the hospital, if it says $250 per night for the first 5 nights, if you go to the hospital, you pay. If you don't, you don't pay. So copay is by usage. Okay?
Thank you. Next question. Can one just sign up for Part B?
You cannot just, you can have just Part B if you want to get a prescription drug only. You can have either A or B, and that qualifies you to get a prescription drug. But if you want to get an Advantage or if you want to get a supplement, you have to have both A and B.
Thank you. Another question is, if you are 68 years old and quit working in January 2024, how soon you have to join Part B without penalty?
Okay, Dave, if you know you are retiring, you can go ahead and apply now, but make it effective January 1st of 2024. Even though you're applying now, you can tell them when you want your plan to be effective. Or if you know, basically you need to have a coverage from January 1st, because if you're retiring in January, then you're not going to have any coverage. So you have to apply now. So starting January 1st, you have coverage. But they give you about a couple months, even if you forget, that you can sign up. But it's important not to be without any coverage. So the best is to apply before you retire.
Thank you. One follow-up question on that. How soon after you retire do you sign up for supplement plan?
The supplement plan, once you retire, basically it gives you 6 months to sign up. But again, if you know when you're retiring, you need to apply before your retirement. So effective the first of the month you retire, you have coverage. Even though they don't penalize you for, you know, for prescription drug, but you need to, for prescription drug, you have 63 days after you retired. You have to get into another plan within 63 days. So
Thank you.
the best is to do it ahead of time. So effective the first month that you retired, you have full coverage.
Thanks. Next question. I was told there is a new plan for 2024 called Medicare Advantage HMO PPO in Southern California. Is this option also available in Northern California?
In Northern California, there is a plan called HMO POS, point of sale. With the HMO POS, your doctor, if they approve, your primary doctor, they would allow you to go out of the network and see another specialist. But your primary has to refer you to go out. It's not really a PPO. We don't have one that is HMO PPO. There is one HMO POS.
Thank you. We have 3 more questions. Can we continue?
Okay. Sure.
What is your advice for people who are planning to work and covered by employers at the age of 65? Do you still need to sign up to avoid penalty?
No, you don't have to. If the insurance that your employer offers you is creditable, which means check with your HR and make sure the insurance they offer is creditable. If it's a large company like Apple, it is creditable. But if it's a smaller company, check with your HR and make sure it's creditable. Because if it's not considered creditable, then you may be subject to penalty. But assuming it's creditable, you do not need to get your Medicare or any other insurance until you retire. Now, a lot of people, since Part A is you don't pay for it, a lot of people, when they turn 65, they get their Part A because they don't have to pay for it. And then they wait until they retire, then they get their Part B because Part B has a premium. So that is one option for you. And some people just wait until they retire, they get A and B together. So again, it's up to you. If you collect Social Security, they send you your Part A. They meaning Medicare, Social Security. They send you your Part A, and you don't have to pay for it. So, but if you don't collect Social Security, you have to apply for it.
Thank you. Is there a waiting period once you sign up for Medicare?
No. No, the waiting period, you have to say specifically when you want it to start. And once it, like if you're just turning 65, the earliest you can join is the first of the month of your birthday. Again, in our previous example, if your birthday is July 15, the earliest you can join Medicare would be July 1st. Now, all the Medicare and all the insurance plans start the first of the month, regardless of your birthday. So if your birthday is on the 5th or on the 27th, you start your plan, Medicare and the Advantage or Supplement plan, the first of the month of your birthday. Always starts on the 1st.
Thank you. There is one question, I think a specific case. I will leave it at the end for the end. And there is one more question. What happens if you are eligible to stay on school medical plan after retirement, but need to pay? Is that considered an Advantage plan?
If you stay on the school
medical plan after retirement, but need to pay.
There are some companies and schools that they offer you retirement medical plan. And in that case, you have to see what they're charging you for the plan. Because once you go into the retirement plan, your cost may be different from when you were active employee. So I recommend is find out how much the plan would charge you under the school or employer retirement plan and compare it with Medicare. If it is Medicare significantly lower, then it would probably make sense to leave that school plan or employer plan and go to Medicare. If it's not, stay with the plan as long as the plan is considered creditable.
Thank you. I'm going to read one more question and then we can continue the presentation. But before doing that, please try to type your question in Q&A box, because when we have a lot of questions, it's hard for me to keep up to see the question. I might not see them if you type them in chat. Please try to type them in Q&A box, which is under the bottom of your screen. And the last question is there a way to find out myself if an insurance is creditable without going through HR?
Generally, HR would know. Otherwise, I mean, in my experience, the HR of the company should be able to tell you. If the company has less than 20 employees, chances are it's not creditable. But if it's a larger company, most likely it is creditable. You can call 1-800 Medicare and see if they're able to help you, but I doubt it because I don't think they have a list of all the companies, small and large, in the United States. The best advice would be your HR.
Thank you, Zara. We can continue.
Okay, now we're going to go to prescription drug. Prescription drug is a little bit more complicated. That's why I paused so that we start the prescription drug fresh. So then prescription drug is also run by private insurance company that are approved and contracted with Medicare. It helps you lower your cost of your drugs. And so once you sign up for a plan for the rest of the year, that year, you're covered for how much you pay for the plan. They cannot increase your premium in the middle of the year. And the premium varies depending on the plan. And with the prescription drug, depending on which plan you sign up, it could have zero premium all the way up to $545. The deductible, again, deductible is once a year in 2024. So if your plan has a deductible somewhere in between or zero or 545, you have to pay the deductible first before the plan covers you. We go there. Remember I said there is a 10% penalty with Part B if you don't have any creditable insurance and you don't sign up for it. Well, Part D for prescription drug also has a penalty. So if for 63 consecutive days in a row, you do not have a drug plan and you do not have any creditable insurance to cover you, then you're subject to a penalty. The penalty is 1% per month based on the national average premium. National average premium is about, it was about $30 to $35, but now it may have increased because this year all the premium increased. But in any event, you pay 1% per month. So let's say, if you say, I don't take any drugs, why do I need prescription drug plan? And I'm going to wait until I, have to get drugs, I'll go and qualify. So let's say if you wait 3 years, 3 years is 36 months. So you have 36% of the national premium would be added to your premium every month for your lifetime, or as long as you are applying for a drug plan. So it could be a significant amount. So it's very important, if you do not use any drugs at all, go and find a cheap prescription drug plan. If it is offered through your Advantage plan, you don't pay for it. So you're covered. You already have a drug plan. If it is not covered through your Advantage plan, let's say if you have a supplement, option 1, then you go and find a cheap prescription drug plan. There are some that are very cheap. So you apply for that. So at least you don't pay so much, but you're not subject to penalty. Now, all of this information, if you get confused or if you want to see what applies to you, is very important to, establish a relation with an agent. I have a lot of clients that they just call me, ask me questions. So, call somebody, ask questions, make sure that you are aware of your rights. Moving on. Okay, so with the drugs, each company has classified their drugs into 5 or 6 classifications. They call the classification tier. So it would be tier 1, tier 2, tier 3, 4, 5, and some would have a tier 6. So tier 1 and tier 2 are generic. Tier 3 and tier 4 are brand. And tier 5 is a specialty, a very expensive drug like chemotherapy or some heart drugs, very expensive. So that would be tier 5. Some companies have selected some drugs out of tier 1 and tier 2, some drugs that are very common, like some diabetes drugs or some cholesterol drugs. They moved it into a tier 6 and they created a new tier. Some, they didn't create it, they just left it in tier 1 and tier 2. So the way it works is, when you have coverage, either is within the Advantage plan or a standalone prescription drug plan, everything I tell you applies. So once you have a drug plan, if your drug is tier 1, it has a cost. Now, everything I give you here is an example. That doesn't mean tier 1 drugs are going to cost you $50. I have no idea on the drugs. You know, it could be $50, it could be $100 for tier 1. I don't know, depends on the drug. But in any event, as an example, let's say if your tier 1 drug is $50, when you have insurance, your copay again would be per usage. Your copay is $1 and the insurance company pays the other $49. So that's good to have insurance. If your drug is tier 2, for example, if it's $90, you pay $3 and the company pays $87, and so on and so forth. So it's important to, the message is if you keep your drug generic, it would be a lower cost to you and the insurance company pays the rest. So it's important to keep your drugs generic. Now going to next slide, in addition to tiers, drugs also have 4 stages. The stage 1 is a deductible. Remember I said the prescription drug could have a deductible from $0 to $545, depending on the plan. So if your plan has a deductible, you have to meet your deductible first. A lot of plans, if they give you prescription drug within the Advantage, you do not have a deductible. Some do, but most of them don't. But if you get a standalone prescription drug, some plans have, again, deductible, some don't, depending how much you pay for the plan. In any event, if you have a deductible, first you have to meet your deductible. After you meet your deductible, or if you do not have a deductible, you start with initial coverage. Within initial coverage, you only pay your copay. Your copay would be the $1, the $3, the $20, the $60, whatever is your copay. Within the initial phase, you only pay your copay. You stay within the copay, within initial coverage, until the total cost of your drug reaches $5,030. This is for 2024. So $5,030 is what you pay and what the insurance company pays. So basically, all of this cost is added and accumulated January, February, March, April, until you reach $5,030. Once you reach $5,030, then you move to the next phase, which is called coverage gap or donut hole. Within the donut hole, you pay 25%, whether it's generic or whether it's brand. And pharmaceutical company pays the other 75%. So you stay within this coverage gap until your total out-of-pocket cost reaches $8,000. Now, your total out-of-pocket cost does not include what insurance company pays. It only includes what you pay. It includes your deductible, includes your copay, and also includes what pharmaceutical pays. So that all gets accumulated until you reach to $8,000. After $8,000, you move to the last phase, which is catastrophic. In this phase, in up to 2023, you had to pay some amount, but starting next year, once you get into catastrophic and you pay $8,000, then you don't pay for your drugs anymore. So the maximum you pay is the $8,000. So that's a good news. Starting next year, you don't have to deal with the catastrophic phase. So it's important, again, if you keep your drugs generic, tier 1, tier 2, most likely you're not going to reach $5,030, and you're not going to deal with coverage gap. Because in coverage gap, insurance company is not covering you. They cover you in initial phase, they cover you in catastrophic, but they do not cover you in gap. And if you fall in gap, all of a sudden you notice the cost of your drugs. When you go to pharmacy to pick up your drugs, all of a sudden you notice you're paying more because the 25% is a lot higher than the copay that you used to pay. So again, keep your drugs generic. And then we move on. Okay, pharmacy network. Each company have a pharmacy network. They call it their preferred pharmacy. And if you get your drugs from that pharmacy, you get better pricing. Or if you get a mail order, you even get a better pricing than the pharmacy. Excuse me. Drug formulary is the list of the drugs. Whether you go online to look at the drugs for your plan or whether you receive a booklet from the company, their drugs are listed alphabetically, and after each drug there is a T and a number. That's for tier. So that would indicate what tier is that drug, and then you can see, they tell you how much you pay for each tier. Again, tier formulary, as I mentioned, it tells you what tier the formulary is. Step therapy is the plan wants you to try generic drug before you want to go to a brand drug. At least try a generic before you go to brand, unless your doctor says the generic doesn't work for you. They don't want the people to just jump and say, I want brand. Because once you use brand, not only it costs you more, it costs the insurance company more. Quantity limit. The drugs are recommended with certain number, like 2 a day, 3 a day, 1 a day. If your quantity is different from what the plan recommends, your doctor can send a request, a prior authorization to the company, and the company would approve it, and then you get the quantity that your doctor thinks you need. Prior authorization is submitted from your primary doctor to the plan, and if it is an emergency that you need it right away, a decision is always made within 72 hours. Okay, now the extra help. Some people may not qualify for Medi-Cal, but they may qualify for extra help with their drugs. The threshold for the drugs for 2024, if your individual annual income is less than $21,870 or a married couple $29,580, so that's one criteria you have to meet. And your resources, if for an individual $16,600, for a married couple $33,240. Resources are generally your bank account, your stocks and bonds. And the house where you live and one car is not considered your resource because you need that. So basically, this threshold is higher than Medi-Cal. So if you don't qualify for Medi-Cal, but you qualify for this, then you get help with your prescription drug, you get help with the premium, you get help with your deductible, you get help with the copays. So it's important to know if you think you are close to this threshold, it's always good to either contact your agent or contact Medicare.gov. They tell you if you there's an application, you fill up, you submit, they tell you if you qualify. Now, if you qualify for this, you may even get the coverage within the coverage gap, the donut hole. They may give you coverage there and your premium. And so finally, this is the information about me. These are the plans that I cover. My agency is Z. Rothenberg Inc. Insurance Services. This is my phone number, email. These are the companies that I represent. So any plan within these companies, I can help you with. Now, one thing you need to know, if you have any questions, even after we hang up, don't be shy, give me a call. Calling me, talking to me It's not going to cost you anything. My services is free to you. If you sign up with the plan, the insurance company compensates me, but you don't pay anything. So don't be shy. Just give a call, ask questions. If you're not sure, which plan is better for you, or is there any other plan that's better for the list of your drugs or something, just give me a call. It's not going to cost you anything. So I can help you with all your questions. So basically, this is it. I'm having any questions?
Thank you, Zara. That was a great presentation.
Thank you.
I think it simplified this complicated process, I guess. Let me see. So we have 25 minutes left. If you have any questions, please type it in Q&A box. If you cannot find it, please type in chat. I will try my best to read all the questions. And Bobby says, excellent presentation. Thank you so much. I agree with you.
Again, if you have, please fill the survey that Nevin mentioned. And if you have any feedback as far as you want to see anything different within the presentation that you think would be interesting to know, let Nevin know, and she would convey that to me, so I would include it in the presentation.
Yes, that's a perfect reminder. The last question, the fifth question on the survey is, if you have any comment, you can type those there.
Yeah.
Let's see. Mina says, thank you for the great information. Excellent presentation. Have a nice day. Bye, Mina.
Thank you.
And Susan says, please, can you show the last slide again? I think the contact information. Thank you. And another question is...
You can take a picture of this if you want to have my information.
Yes, again, this session is being recorded, and I am going to share the link for recording with you all. And if Zara is okay with the presentation slides, I will send them along with the recording link. I'll check with Zara later.
Yeah.
If you sign up, so the question, if you sign up for Medicare, but later is qualified by employment covered insurance, can you cancel Medicare and re-sign up until retirement?
Yes. In this case, you probably don't cancel your Part A because you don't pay for Part A, but you can cancel your Part B. And then once you retire, then you go and apply for Part B.
Thank you. Next question. Can you please repeat the out-of-county guidelines for using Medicare? If you are not 65 and have other insurance, is there a penalty?
Out of county?
Out of country.
Oh, out of country. Yeah, if you are under 65, the Medicare, it doesn't, you see, the out of the emergency coverage, wait a minute. Okay, the emergency coverage is either for option 1 or option 2. It's not for Medicare. So if you go out of country and you have any of this, as I explained to you, if it is emergency, when you pay and you get reimbursed when you come back. But if you only have Medicare and an employer insurance or something, the employer insurance may not cover the emergency out of country. So it all depends what your situation is. So I don't know if I'm answering it or not. Is this anything else in the questions that?
It was, I think the same person was asking, can you repeat the out-of-country guidelines for using Medicare? I think we covered it.
Okay.
Is, if it's emergency.
Yeah.
Yes.
If it's an
not,
emergency, the option 1 gives you $50,000 allowance, but you have to pay 20% with $250 deductible. And option 2, which is Advantage, it covers you within the requirement of your plan. For example, if your plan says you have to pay $250 per night for the first 5 nights, or $380 for the first 7 nights. Whatever the plan requires, that would be your coverage that you have to pay out of pocket. The rest of it, the plan covers you.
Okay, thank you.
That
And
also has a limit. You know, they don't, if you incur like $100,000 of cost, they're not going to cover it. So it's within a limit. I believe they they may have something like $100,000 limit here.
okay, there is one question about the link for the recorded session. So since you sign up for this webinar, I have your email addresses. And then after the program, sometime this week, I am going to send the link to your email address so you can view it again. And also it will be posted on our YouTube channel. You can share the link with your friends or network, whoever is needed this information. I think there are some specific questions. Can we
Sure, let's go to the specifics.
yeah, let's one of them was earlier. I have a special case. I have long COVID since May 2020. I have not worked since then. I am currently 67. I have Medicare Advantage and wanting to get a specialist, but the plan I have does not offer anything for this. The doctor believes that all my problems are because of my thyroid. What can I do, get help, and possible apply for disability? It's a very specific question.
Yeah, the disability part of it, you have to apply with the Social Security and the state for state disability. So that would be something that you have to see what their requirement is and whether you qualify for disability. But it sounds like you are already 65 and you already have an Advantage plan. And if you see your Advantage, there are Advantage plans that are for chronic illnesses. So if your illness falls under chronic, you can sign up for an Advantage plan that's a specific, focuses on your needs. So and right now is annual enrollment. So it's a good time to look into that and see which county you live and what your chronic illness is and see if you qualify for a chronic Advantage.
Thank you. And Zara, someone is asking, can you please go back to your slide, which shows your contact information?
Sure.
And also, as Zara mentioned, if you have really specific questions like this, I think please feel free to contact Zara and talk
give
more
me a
about
call.
that.
Then
It
I
doesn't
can
cost
ask you.
anything to you, right, Zara?
Yeah, exactly. See,
Okay.
then I can ask you specific questions and say, well, what is your situation? What do you
Yes.
want to do? So it's kind of hard to cover everything in like a seminar.
Okay. So next question. Someone retired and planned to move back to their original country and not move to USA again. Can they skip to pay the Part B?
Yeah, you can skip Part B, but then you're not covered under Part B. I mean,
They are not planning to come back to USA.
If you're not coming back, yeah, you can cancel your Part B and just move back to your country.
Okay.
Because if you're planning not to come back, you don't want to pay for your Part B. You might as well cancel it.
But if they want to come back?
If they want to come back, depending if it's a short period of time, it's probably recommended to continue paying, or if you cancel it, when you come back, you can apply again. But if you're going to go back and forth, you don't want to apply for B, cancel it, apply for B, cancel it. So it's kind of not going to work that way. So you either keep it or you cancel it.
Thank you. Next question. I will be moving to California in 2024. Should I get a Plan M before I move, or get a plan that has coverage in both states?
If you're moving from another state, If you have a supplement plan, that supplement plan would work in California. All you have to do is you have to find a new primary doctor, you know, or a specialist or whatever you want, because you don't plan to go back to, let's say, Nevada constantly to visit your doctor. So you keep your plan, you inform them of change of address, and you find new doctors in the new county, in new state. So if you have an Advantage plan, you qualify for a special enrollment, and then depending which county you're going to live in, California, then you can talk to me or an agent and see what plans are available in that county for you, so you can sign up to a new plan.
Thank you. That was the last question. I think I checked everything in chat
Okay.
and Q&A box. We can wait a few more minutes. Again, if you have any questions, please type them, and Zara will be here a few more minutes. Thank you, Zara. That was a great presentation. I will go ahead
Welcome.
and stop recording now.
Okay.
But again, we will be here a few more minutes in case.
Yeah, I'll stay another 5 minutes, and then after that, if you think of a question, either my email is here, you can email it to me, or you can call me, and you know, I'm always available to answer your questions.
Thank you.